Okay, so gestational trophoblastic disease, it is a disease characterized by tumor-like condition in which proliferation of trophoblastic tissues of the malignant potential occurs. There are two main types of gestational trophoblastic disease. One is Hydatiform mole and another is gestational trophoblastic neoplasia. Now, Hydatiform mole is also divided into two types of the moles, complete mole and partial mole, while gestational trophoblastic disease is of three types: invasive mole, choriocarcinoma, and placental site trophoblastic tumors. So these are types of gestational trophoblastic disease. Now we will start from Hydatiform mole. It is a disease which is characterized by gestational trophoblastic disease that results in abnormality of fertilization. Means when fertilization of abnormal cells occurs, abnormal chromosomal distribution will lead to gestational trophoblastic disease. In this disease, cystic swelling of chronic villi accompanied by various trophoblastic proliferation occurs. It is associated with increased risk factors like previous history of molar pregnancy, maternal age, maternal blood group, and diet are risk factor for development of the gestational trophoblastic disease. Now these are of two types. One is the complete mole and another is incomplete mole. Incomplete mole, it is also known as androgenic mole, in which fertilization of an empty ovum occurs. That's why the number of karyotype will be 46xx. So it occurs because there is fertilization of empty ovum occurs. All villi are edematous in this incomplete mole. Vessels in the villi are absent and trophoblastic proliferation is diffuse and circumferential. Embryo is not viable, therefore no fetal parts are present in this. Serum and tissue human choriogonadotropin is markedly elevated, with transformation of choriocarcinoma is common in 2% of the population. Another is incomplete or partial mole. This is triploidy, in which what happens: an egg with one haploid maternal chromosome is fertilized by two sperms. That's why number become exceeds 69xxy. That's why it is known as complete or partial mole. Some villi are edematous in this condition. Vessels in villi are normal, with trophoblastic proliferation is focal and slight. Embryo is viable and fetal parts may be present. Now serum tissue HCG is elevated slightly and transformation into choriocarcinoma is uncommon in incomplete or partial mole. Now how the patient will present with the first trimester vaginal bleeding, with uterus is large and vaginal passage of vesicle containing products of conception, and abnormally high level of HCG. So this is the discriminatory point. And presentation of the patient: exaggerated pregnancy symptoms seen in hyperemesis, hyperthyroidism, and early preeclampsia will be there. Investigations will be serum HCG, which will be greater than 1 lakh, and a full blood count to check anemia and thrombocytopenia, coagulation profile to assess the coagulopathy of the patient, LFT, blood urea nitrogen creatinine, blood type, and RH, with thyroid function test and hyperthyroidism. Serum inhibin A level is markedly elevated, with serum inactivin A level also elevated. Imaging ultrasound will be diagnostic method of the choice. In the partial mole, complete mole shows snowstorm appearance. This is the diagnostic point, which is snowstorm appearance. And in Hydatiform mole, complete mole, there will be hydropic villi and intrauterine hemorrhage. So this will, so how we will treat this patient. For treatment, we will perform dilation and curettage. Hysterectomy is an option for the women who have complete childbearing. Weekly beta hcg titer ranges from 3 consecutive weeks, so level should be dropped, but and should never increase. If the serum HCG plateau rises, then the patient is considered to have malignant disease, gestational trophoblastic neoplasia, which is another types of gestational trophoblastic disease. So in this way, we treat the patient of Hydatiform mole. Now another type of gestational trophoblastic disease is gestational trophoblastic neoplasia. As the word is neoplasia, which means proliferation of trophoblastic tissue and penetrates into the uterine and leads to different consequences. Uterine choriocarcinoma is pure epithelial malignant neoplasia. It is most aggressive type of gestational trophoblastic disease, and it risk factor are Hydatiform mole, previous abortion, normal pregnancies, and ectopic pregnancy. Another another is placental site trophoblastic tumor. These are the tumors of the trophoblast, and elevated level of HCG is also present in this, and the risk factor are normal pregnancy, spontaneous abortion, and Hydatiform mole. Now, how we diagnose gestational trophoblastic neoplasia? By vaginal bleed, amenorrhea, and metastasis to the lung, vagina, CNS, and liver. These metastases will present with consecutive side effects and signs and symptoms, and in this way we can diagnose metastasis. In lung is most common in gestational trophoblastic neoplasia, then vagina, then central nervous system, liver, and spleen. Investigation will be ultrasound, HCG, chest X-ray will show cannonball appearance. Cannonball appearance in gestational trophoblastic neoplasia. Cannonball appearance will be there, and chest X-ray, abdomen, and pelvic staging should be done. And the treatment of gestational trophoblastic neoplasia will be single agent chemotherapy like methotrexate is given, actinomycin D is given, gold therapy is remission therapy, and follow-up should be for 1 year. Poor prognosis is there because multiple chemotherapeutic agents like etoposide, methotrexate, actinomycin D, cyclophosphamide, vincristine, and leucovorin is causative agent of poor prognosis. So this was gestational trophoblastic disease, and we studied that the gestational trophoblastic disease is divided into two. One is mole, Hydatiform mole, and another is gestational trophoblastic neoplasia. And the Hydatiform mole was divided into complete mole as well as into incomplete mole, while gestational trophoblastic neoplasia were of different types in the choriocarcinoma, and trophoblastic proliferation carcinoma of the trophoblast. In this way, there were different signs and symptoms related to the types of the gestational trophoblastic disease, and the treatment was chemotherapy and remission therapy. So this was gestational trophoblastic disease.